Okay. Yeah, as Nate said, my name is Jonathan Johnson. I'm the harm reduction program manager with Knox County Health Department. And I'm also the co-chair for the Homeless Coalition Outreach and Engagement Committee. And today I just wanted to talk about kind of an idea that we have in the works about a regional outreach cooperative. So what does that mean? So an outreach cooperative, what we're hoping is that it's a forum where information, supplies, and just general outreach routes are shared across organizations. We're hoping that it provides a structure that allows for interagency teams. And so kind of our current outreach MO is that agencies more or less kind of pair up within themselves. They send out a team of two, maybe three, and go out, and going out with other organizations is kind of the exception to the rule. And we're hoping to make it kind of standard for organizations to go out in groups of maybe 3 to 5-ish as a group. And then it will provide a forum that allows outreach workers to receive donations from the community and ask directly for what they need. So where did this idea come from? I hear so much about this conference that a lot of people went to in Chattanooga that I didn't have the benefit of going to. But at this conference, we learned about the outreach model that they're doing and have been doing in Chattanooga for going on over 2 years. Um, and the backbone of that is kind of their coalition and their health department. But as it says on the slide, in Chattanooga, their regional outreach cooperative includes over 20 organizations, and has grown to where they have doctors and nurses from Erlanger Hospital that go out with them on Fridays, which is their day when they have kind of denser routes where they know they're going to run into more people. Um, they have, whenever I had the opportunity to shadow their outreach teams in Chattanooga, they have a lot more pets, a lot more furry friends out than I think a lot of us are used to. And so they have vet clinics that go out and they donate dog food. They have a vet, like a mobile vet clinic that'll go over to camps as well. And the outreach cooperative even includes like coffee shops and stuff, like organizations who might not be doing outreach with them, but agree to donate supplies. And so in the winter, coffee shops will give them um, big carafes of coffee that they can take out to neighbors. Um, Substance abuse and mental health agencies go out with them, and many more. And so it's very standard for them to have a team of like 4 or 5 people all going out. They meet up at a church ahead of time and pack supplies together and then hit the road. So where are we at with this in Knoxville? Because we're trying to more or less mirror what we're seeing in Chattanooga. So we're still in the early planning phase with this, and how we want to do this in Knoxville. Rosie and I drafted and proposed to the executive committee early confidentiality agreements and MOUs, which would form the kind of bureaucratic backbone of it, basically. And these were approved by leadership, but have not actually gone out for signature from any agencies yet. We're starting to pilot some small interagency teams. And so that includes through a separate project, like VMC and the health department are going out together. And we're just going to kind of see what that looks like to have two organizations going out together, how different protocols and policies interact with each other, and what adjustments we might need to make. One idea that we've stolen with permission from Chattanooga is having training material that required for onboarding as part of the ROC. And so any organization that wants to participate, in addition to signing the confidentiality agreement and MOU, would go through a brief training that just kind of goes over what the expectations are, what it means to participate, and how we participate in a way that's respectful to our neighbors. And so as part of that onboarding, that training material is still in development, although a draft of it has been completed. And then the hard work that really Rosie is spearheading is mapping out current agency service areas. So knowing where agencies are currently going, because if you've done outreach, you know that It's already kind of staked out who goes where and who knows certain parts of Knox County more than others. So we're just trying to see where we can learn from other agencies, and see what coverage is already there. So what is the rollout of this thing going to look like? For now, I would say stay tuned. We're figuring out how we want to approach agencies and get these documents over to you. However, if you or your agency are interested in learning more, either Rosie or myself is happy to set up a call and we can talk through what that involvement looks like, and we can give you a kind of more detailed look at the documents and ideas that we've had so far. So that was my lightning round. If you have any questions, I'll pause and take those now. No questions is good too.
No question, but just a statement. This is phenomenal work. I know there's been a lot put behind it, and I'm really excited about next steps.
Thank you.
You also got a couple not a question comments in the chat saying basically the same thing. This is phenomenal. This is exciting for the community, and it's been a long time coming. So thanks for, from all of us for the efforts that have gone into this. This has not been easy, and it's not done. It won't be easy coming forward. So we'll try to stay a wind behind you through all this. So thank you, Jonathan.